everyone. Good afternoon and good evening. My name is Julie Dana. I'm the head of the Global Facility for Disaster Reduction and Recovery and a practice manager in the World Bank Group's Climate Change Global Practice. Thank you everyone for joining today's webinar on managing tropical cyclones during COVID-19, early lessons learned. Before we begin, I would just like to inform everyone to make sure your microphones are muted. We will not be taking questions through the audio or the chat room. Please use Slido to submit your questions, and we'll address those during the Q&A. Please also turn your video off so that we can conserve the bandwidth. We have a number of people joining from all over the world, which is fantastic. The session's being recorded, and it will be available for viewing later on our website, GFDRR.org. This webinar is the second of our series on building resilience in the context of COVID-19. And here we're exploring how disaster risk management and preparedness can help societies, economies, and systems build back better and stronger in this COVID-19 recovery phase. Please join the conversation on social media as well, using the hashtag Building Resilience. Really extremely pleased and privileged today to have 4 speakers from around the world, from the Pacific, South Asia, East Asia, and the Caribbean, who are really on the front lines of this topic, literally as we speak. And I want to thank them all for taking time from their very, very busy days and evenings to join us for this hour. From Vanuatu, we have Esleen Garabiti, the Director General of the Vanuatu Ministry of Climate Change, Adaptation, Meteorology, Geohazards, Environment, Energy, and Disaster Management. It's very late in Vanuatu, so Esleen, thank you so much for staying up to join us. From India, we have Kamal Kishore, a member of India's National Disaster Management Authority, and Kamal is also currently the co-chair of the Global Facility for Disaster Reduction and Recovery, now for the second consecutive year. Welcome, Kamal. From Japan, I'd like to welcome Professor Muniyoshi Namada from the Disaster Management Training Center at the University of Tokyo. And from the Caribbean, Elizabeth Riley, Executive Director of the Caribbean Disaster Emergency Management Agency in Barbados. So as we see the COVID-19 pandemic reverberating around the world, every country is impacted and response actions are necessary regardless of the scale of the impact of the crisis. We're seeing this global health emergency testing the ability of emergency preparedness and response, and in particular, highlighting the importance of coordination among national disaster risk management, civil protection agencies, and health agencies. So we see while governments are responding to the first wave of the pandemic, they're also preparing for a potential second wave. And in parallel, the threat caused by existing natural hazards creates a compound risk for many countries already coping with precariously high levels of disaster risk. This requires adaptive preparedness and response, and it's certainly an environment of global learning as we're doing. So as we're in the midst of this major global health crisis, disasters are just not staying at home. To name a few, in late March, magnitude 5.3 earthquake hit Zagreb, Croatia, the largest earthquake in 140 years. In April, Cyclone Harold, a Category 5 cyclone, struck Vanuatu. In May, Cyclone Amphan devastated the border region between India and Bangladesh. And just this week, record rainfall and widespread flooding on Japan's islands of Kyushu and Honshu left dozens dead or missing. Thousands of people have had to evacuate in the midst of the COVID pandemic. On behalf of the Global Facility for Disaster Reduction and Recovery, I extend our sincere condolences and sympathies for the heartbreaking loss of lives, injuries, and damages experienced by the communities represented by our speakers today and around the world. By their very nature, we know hurricanes, cyclones, and earthquakes force people to gather closely together in shelters during evacuations. And those high numbers and densities are obviously very problematic during the context of an outbreak. Vulnerable populations, such as residents of senior care facilities, medical facility patients, individuals with disabilities, are particularly affected and of great concern. So while the specific complex disaster response looks very different from country to country, proactively planning responses is a job that many people, and these experts here today, are involved in really 24 hours. We're seeing leaders at all levels, local, state, and federal, planning and preparing dual disaster responses in the context of COVID-19, and looking at how their existing emergency management systems are prepared to address this complex situation. They're also doing that in the context of limited resources, since a number of response capacity systems are already at capacity or overwhelmed. Just in this region, in North America, the U.S. National Oceanic and Atmospheric Administration is forecasting 3 to 6 major hurricanes in this hurricane season. So in this session, we want to bring together a set of experts, practitioners who are on the front line of these issues right now, and really give the 4 of you a chance to share experiences with each other and also with a global audience. I really feel privileged to have this opportunity together with all of you to listen and learn from our speakers. And Esleen, let's start with you, joining us very late in the evening from Vanuatu. What's your experience so far? What have you learned, and what can you tell us? Esleen, it looks like we're pulling up the slides. Are you there? Okay, it looks like we may have some technical difficulties connecting Esleen. Kamal, you were up next. Do you want to kick us off?
Thank you very much, Julie. First of all, I would like to thank GFDRR and you and colleagues for setting this up. This is a very timely discussion for at least our part of the world. The season of hydrometeorological disasters is not over yet, so whatever we can draw upon in terms of the experience that we've had in the last month and a half, that will be useful for ourselves as well as for the others. So as far as India is concerned, in May and June, we've had two major cyclones. On 20th May, there was a cyclone which hit the east coast, Odisha and West Bengal. It also affected parts of Bangladesh. And on 2nd of June, we had an event on the west coast which affected Maharashtra. I think overall we can take some satisfaction that in this difficult time we managed okay. There is big difference in terms of the impacts. In the first event, both Odisha and West Bengal were affected, but one state had 94 fatalities, the other had 4. And it's not all because of that, but to a large extent it was, how well we were able to prepare our communities in these two states. I'll talk a little bit more about that. And the Maharashtra one, we lost 6 lives. But I think in the given circumstances, it's very, very challenging. So without going into the details, I just want to highlight 6 early lessons. I think the first thing is that we really need to revise very quickly in a significant way standard operating procedures for evacuation, putting people in cyclone shelters and so on in the context of COVID-19. Just to give you an example, in the state of West Bengal, through a project that we have with the World Bank, the National Cyclone Risk Mitigation Program, we have cyclone shelters. These cyclone shelters have a capacity of keeping something like 500,000 people. But if you apply social distancing measures, even very conservatively, even take a very risk-based approach and take some risks, the capacity is less than 40% of what we had before. So we really have to think about how we revise SOPs in light of the social distancing measures. We also need to make sure that in doing this, we really are getting qualified support from epidemiologists so that we can really take a risk-informed decision when we adjust our standard operating procedures. It also means, for example, how do you move people? You don't move different cohorts so that you avoid the risk of cross-infection from one cohort to the other cohort. So I think that there is a whole body of experience now that is quickly coming out as to how do you do evacuation, particularly early warning, and putting people in shelters or wherever they are evacuated, providing for them in terms of food and water and sanitation facilities so that you also minimize the risk of COVID-19. The second is that there is a big need to repurpose existing capacities and resources. So cyclone shelters, when they go from 500,000 capacity to 200,000, you obviously have to do something about the remaining 300,000 people. So then it requires us to look at schools, colleges, which are currently not functioning anyway, they are all closed. Look at how they are actually mapped on the risk map. We've done risk assessment before. So we know which one of these can be repurposed and used as cyclone shelters in this case. The third point, it doesn't happen very often that we participate in a disaster response where responders themselves are at a very big risk. So all our emergency responders, and we aren't even halfway through the hydromet disaster season, all our responders are at risk. They need to have access to personal protective equipment. They have to be redesigned in such a manner that they are not just personal protective equipment, but they're also easy to move in and do the work that they need to do. They need to have easy access to testing. There needs to be how they operate among themselves. If you find one infection, you have to isolate the entire unit. So you really have to come up with a plan for response forces protection themselves. In the first cyclone that we had on 20th May, about 100 of our responders tested positive soon after the response. Thankfully, all of them have recovered at this time, but this is really a big issue, and we have to, in doing so, we also have to work with the responders in providing them psychosocial support. They are also under a lot of stress. There is a lot of risk of COVID-19 and the mental stress it causes, being exposed to that. So they should have easy access to psychosocial support. They should be able to call. In fact, we have a set of volunteer psychosocial counselors who proactively speak to all our people and provide psychosocial first aid. The fourth thing is that for a lot of things that for a lot of post-disaster work that we use to take people to hospitals, we have to see whether that caseload can, emerging from a cyclone or other disasters, can be managed elsewhere, so that we do not increase the burden of hospitals which are already struggling with COVID-19 related issues. In the evacuation process, we have to make special provisions for elderly. There is already in the earlier standard operating procedures for evacuation in normal times, not just in COVID-19 times, there was work done to look at how we will take care of elderly. So there is some work, but we need to build on that, because in COVID-19, the same thing manifests slightly differently. And of course, hospital preparedness, there is an ongoing struggle to keep up with the demands on hospitals, but we need to continually adjust this. Before the cyclone season started, we issued advisory from NDMA as to how health sector and health infrastructure, particularly in coastal areas, need to prepare itself for wind-related hazards. Next. Now, I would like to just highlight a few things about what is the unique role of DRM agencies. I think a lot of the basic things that the disaster risk management agencies do for other disasters are quite applicable in COVID-19 as well. One thing that one can highlight is how do we use the existing risk assessment tools for trying to stay a little bit ahead of the spread of COVID-19 itself, have some sort of local level predictive capability so that we can prepare our health response a little bit in advance. So the basics of a disaster risk assessment, looking at the level of hazard, looking at who is vulnerable, how long they are vulnerable, and what are the capacities, looking at a product of all of this and staying ahead. So some of the risk assessments tools that we've traditionally had, we've tried to repurpose them and use them for providing support to state governments, local governments in doing an assessment of risk. Of course, there are also many lessons there. We are also detecting inadequacies of our risk assessment systems. They are not granular enough. They do not often take into account local drivers of risk. So that's another set of lessons on our DRM practice of risk assessment. There are a couple of other things to say. Over the last 15 years or so, we've been talking about mainstreaming disaster risk reduction, and sometimes we tend to give this impression that the battle on response preparedness has been won. But COVID-19 is showing that we are far from where we need to be. So it really has underlined the fact that we need to invest much more in response mechanisms. Even in the most advanced countries with very strong systems of disaster response, we are stretched. So I think there has to be some rethinking as to how we begin to further strengthen our response mechanisms, while we, of course, do mainstreaming of disaster reduction as well. Thank you very much, Julie, and I look forward to engaging in a conversation later on in this webinar.
Thanks very much, Kamal. You brought out some of the key themes I know that are going to be running through all of these discussions, which is collaboration with health agencies, the need for the decision making and the processes that are being implemented at a very local level, driven by very, very local context, which differs across places, and then also just thinking about how do you very, very quickly adapt these standard operating procedures and plans. I think Esleen is now connected. Esleen, I introduced you at the beginning of the session. I think you might have had technical difficulties, but if you're able to connect, our team can project your slides, and we'd love to hear from you from Vanuatu.
Good night, everyone, or good day. So I'm Evelyn, I'm the Director General for Ministry of Climate Change. I'm also Chair of the National Disaster Committee for Vanuatu. We'll go directly to the next slide, please. So I will talk about how we manage with multiple disasters lately. Since the beginning of 2020, we were responding to 5 different disasters. So in Vanuatu, the state of emergency for COVID-19 was declared in March 26, 2020. Since the declaration of the state of emergency, it was declared under the Constitution, so it restricted a lot of the rights of people to move around. While we were in the state of emergency, then we had that tropical cyclone, Category 5 cyclone, Harold, that made a landfall on one of our islands, and around 30,000 people have been affected. 30,000 households have been affected by that Category 5 cyclone. We had a reviewed Disaster Risk Management Act that was gazetted and published in February 2020. And it was through this new act that we have been able to respond to the different disasters that we have been facing. So we started with, after the declaration of state of emergency, we also had a volcanic ashfall on one of our volcanoes that we need to respond to. And while we were assessing the impacts of the ashfall, we also had that tropical cyclone. And so we had to respond to all of them. So there are 5 different disasters altogether that we had to respond to. And through the new act of disaster that was published, it highlighted the power of the Director for Disaster Management Office to be able to direct organizations and organizations and also people to be able to assist. So there is the state of emergency. Once when we had this tropical cyclone, Category 5 tropical cyclone, we were in the midst of a state of emergency where the transportation is limited and the movement of people was also limited. So the response, the first aerial survey on the islands was carried out on the 9th of April when the state of emergency lapsed. And then we declared the state of emergency on the 11th of April. At that time, the state of emergency declared was over the 3 different disasters. the tropical cyclone Harold, the COVID-19, and also the Tana ashfall. So through the with the declaration of a state of emergency, there were regulation orders that have been issued by the minister responsible for climate change. And those regulation orders gave directions to government ministries that have to assist the National Disaster Management Office to respond to this pandemic, but also to that Category 5 cyclone impacts. So measures have been issued, and we had to engage the local businesses. All ministries across the public service in Vanuatu have been mobilized to assist the National Disaster Management to respond to all those disasters. At once, in one hand, we wanted to manage to respond to the impacts of tropical cyclone Harold, but at the same time, we want to keep Vanuatu free from COVID-19. So there are various committees that have been formed at the time to all the directors responsible for border. They formed the task team for COVID-19 to look at different measures to ensure that Vanuatu is kept free from COVID-19. And other directors that are responsible for disaster management clusters have been appointed to the provinces and communities that are very affected to control the operation there to respond to the impacts of disasters. So if we can compare to our previous ways of responding to disasters, and even in a way of preparedness in the next slide, we can clearly say that right now our level of preparedness in our warning systems have been improved. Our NDMO, the National Disaster Management Office staff, so they are young, but they are motivated and more experienced through the past disasters. And we have a cluster system in place in Vanuatu that is very active, and we have also the strength that we have in Vanuatu is in terms of preparedness is we have very good well-established structures of governance at the national level, provincial and community level through the Ministry of Internal Affairs. And also the coverage for the communication is more better than in the past. In terms of the response compared to the past disasters that we were facing in Vanuatu, there has been a rapid activation of the community structures after the cyclone Harold. As we all know that cyclones at magnitude or at that level of impacts cut all the communication lines. So only the community structures have been activated to help to have mutual exchange and mutual assistance between the communities in the villages that are highly impacted while waiting for the assistance from the national level. Even though the response was slower, it was slower due to the lack of assistance that we used to get from the external support in terms of logistics. So we have less external support in terms of food items and non-food items, but we have an operation that is very locally owned, both at the national level, the provincial level, and also at the community level as well. And all things have been better recorded, better coordinated assessment activities and reporting, and also better support and capacity building across the whole public service. Most of those departments have never been part of It is a typical operation before, but this time we have been mobilizing a lot of people to assist, and especially in the public service and the private sector as well. So there is a strong engagement, better engagement than in the past between the public sector and also the private sector. And if we talk, if we evaluate or we judge the restriction that we have been imposed through the COVID-19 issue, these restrictions have allowed, in fact, have allowed us, in Vanuatu, to appreciate the fact that we have the capacity to respond and to cope with natural disasters and impacts without any external assistance as we used to have. And this is something that we are very proud of, and thanks to COVID-19. In terms of the new law that have been published this year, it is something that I think it was in the basis of the whole coordination that we have done this year that is better than in the past. Because this new law is have specified the powers of the director and the powers of the minister responsible for NGMO, and also the different responsibilities of the not only of the people directly involved with the disaster, but also other peoples that can be instructed by the director during a state of emergency or when the disaster hit in Vanuatu. And also through this new law, there were regulation orders that have been detailing the instructions to the organizations to assist in the NDMO in the whole process of response to TC Harold, but also to COVID-19 as well. So we ended up by having not one operational center for disaster response, but we ended up with 6 or 5 provincial operational centers that have been established to better coordinate the response from the national level to the community without any logistical assistance from our partners due to COVID-19 restrictions. So that's something that in general have been working well for Vanuatu this time, and the lessons that we learned that on the fact that we appreciated the capacity that we have in Vanuatu among us, that we can deal with disasters, and that affirms our resilience to the natural disasters, even though we are prone to all natural hazards, but we the way we responded to the recent disasters prove us that we can continue to stand, and we can improve more and more in all the procedures that we use to respond to natural hazards in times to come. And even though right now we just there's going to be an extension of the state of emergency of another month on COVID-19, and we will continue to cope, and our aim is to continue to maintain Vanuatu free from COVID-19. Thank you very much.
Thank you, Director General. That is really a powerful story, and many things that I think you can pick up on, particularly the role of the communities, the activation of your communities. And I'm really overwhelmed by the positive message that you have at the end, reaffirming Vanuatu's resilience and the capacity of structures and your leadership. So congratulations. It's an amazing time, and I think we will continue to have a lot to learn from you. Thank you so much for being here. I'd like to turn now to Japan. So to Professor Numada, you're right in the middle of a response as we speak. What can you tell us?
Okay, hi. Can you hear my voice?
Yes, we can. Thank you.
Okay. Hello. My name is Muneyoshi Numada, Associate Professor at the University of Tokyo. So I'm also the head of the Disaster Management Training Center, DMTC, at the University of Tokyo. Thank you for Julia Dana and Sayaka Yoda-san and Guillermo-san in Tokyo Hub office to support me. Okay, so my research focus on the designing and implementing disaster risk management, disaster risk reduction framework, building on Japanese best practice and expertise, which combines engineering and social science to improve existing systems already in place. I apply this work to municipalities, prefecture, and local people in Japan and the other countries such as Sri Lanka, Myanmar, and Indonesia. So this research and experience are also shared with local government through my work at the DMTC, Disaster Management Training Center, especially by providing training on the development of comprehensive process of emergency preparedness and response and improvement of decision making by all relevant stakeholders. In times of real disasters, I work directly with municipalities, prefectures at their EOC to provide technical support and facilitate the response process management. Based on my experience working with municipalities and prefecture in Japan to improve their emergency preparedness and response system, I would like to share with you today some challenge we have been facing in management of vacation center in Japan under the COVID-19 pandemic. Next slide, please. Okay. In this slide, I have listed the top 5 challenges we are facing in Japan when managing shelters during the COVID-19 crisis. Number 1, complication to response under COVID-19. Evacuation shelter management usually rely on support from various stakeholders in Japan, including local government officials, non-profit organizations, NPO, and volunteer and community members. All of these stakeholders need to understand clearly the response process. However, with all of the added setup rules and regulations due to the COVID-19 pandemic, it quickly became a complicated process on how to provide efficient and smooth response among shelters. Number 2, information management. To avoid risk of COVID-19 infection and guarantee social distance, a number of extra shelters were required to be opened and operated in this recent disaster. However, with the added number of shelters, the collection, sharing, and monitoring of information has become very challenging. Number 3, limited human resources. Shelter management requires a large number of staff with added stress and requirement from COVID-19. Many municipalities lack personnel. Therefore, the optimization and careful planning of staffing scheduling needs to be done to reduce inefficiencies. Number 4, complication of logistics for equipment and materials. It has become obvious under this pandemic that there is a higher need for extra equipment such as masks, hand sanitizers, and medical equipment at the shelters. In many cities, these type of materials are difficult to access. due to high demand. Therefore, careful planning on how to secure these materials need to be in place. Number 5, enforcement of basic hygiene rules. We all know what to do avoid infection risk. Wash our hands, wear masks, and respect social distance. But how do we enforce these rules to users in shelters? Okay, this is some I just list up. Okay, so next slide. This slide key suggestions to improve preparedness. Here are some suggestions. Number 1, continuous update the SOP and always try to have a plan in place. Before disaster strikes, ensure responding teams have a detailed response plan and manual in place to avoid confusion and ensure efficient response by all stakeholders. Number 2, have a system in place to manage information on shelter environment. For example, each shelter should keep track on the number of evacuees, number of infections, number of people with fevers, etc. Ideally, there should be a system where local municipalities can look at this type of information for better decision making. In Japan, we have created online system where all shelter information can be uploaded and be read by other shelter managers and the EOC. Number 3, plan to optimize human resource allocation. Scheduling should be in place. Number 4, stock information about materials at each shelter should always be recorded and available so that delivery plans can be made efficiently. Number 5, among evacuees and shelter managers decide on basic policy among the evacuees and shelter managers so that the measures to avoid infections are integrated into routine. Okay, next slide. Okay. Lastly, I'd like to talk about the business operation support system we call BOSS, which we developed by the DMTC. So this system supports all procedure or flowchart for the comprehensive disaster activities. So this system now used in Kumamoto Prefecture. Now currently they are under the operation for the heavy rain. So today this photo is a EOC in Kumamoto Prefecture yesterday. So now Kumamoto Prefecture use this flowchart system to check one by one their activities. So today this heavy rain, some major damage. Now today 57 deaths and 12 missing persons due to heavy rain and flood. So then to improve these response activity system by helping government officials come up with a detailed manual for response to ensure smooth management of personnel, efficient response flow, and effective communication system. Okay, thank you for your attention and look forward to our conversation today. Thank you very much.
Thank you very much, Professor. That's, as always, a very, very well-structured, clear set of issues that I think everyone on the line is benefiting from seeing your perspective and how you're approaching these issues. So our last speaker is from the Caribbean, and Liz, I think you are probably in some ways, as the executive director of the Caribbean Disaster Management Agency, in some ways a major audience for these these stories of experience and these perspectives from the other countries that have already experienced events. But very curious to hear how you're preparing, what you're thinking, and anything else you'd like to share with us today. Thank you.
Hi, good morning, Julie, and good morning to all the participants to the webinar. Let me start by saying a big thank you to you, Julie, for the invitation to SEDIMA to participate. And I listened with great interest to the experiences from the other regions, because as you know, we are 1 month and 8 days into the Atlantic Basin hurricane season. And whilst we have had 5 named storms thus far for the season, we've not had an impact on this side to any of the SEDIMA participating states for 2020. So a lot of what I will speak to is the actions that we're taking on this side, also learning from the lessons of the other regions, because we have been following those very closely as well. So what are the things that we're doing differently on this side? Well, 6 things I wanted to touch on. One is related to governance. So given the COVID-19 event, we have adjusted the governance arrangements within what we call our regional response mechanism, which is the Caribbean's mechanism for coordinated response to impacted states. And we have integrated a new operational cell into the governance arrangements, one that focuses particularly on the area of health. So we have the health expertise through the Pan American Health Organization and the Caribbean Public Health Agency. And we also have some specific support from the University of the West Indies, which is undertaking modeling and also surveillance. And this is assisting us with the evidence basis on what is happening with COVID-19 to inform our operational planning. We've also modified our operational plans and operating procedures, and I heard this referenced by a lot of the previous speakers, so I won't go into this in great detail. We've also been looking at the whole aspect of how we can better integrate the use of information and communication technologies in executing some of the critical emergency support functions. And this would include, for example, damage assessment. And we've been in discussions with the Caribbean Institute for Meteorology and Hydrology, not just with respect to the use of instruments such as drones, but also in testing a virtual reality platform that they've developed, which allows us to drape satellite imagery, which is taken immediately post-disaster, over previously developed digital elevation models, and to be able to view what has happened in terms of the impacts of cyclonic systems. So this is an area that we want to test out for 2020, given the COVID environment. On the exercising side, this is an important part of our programming, and we have integrated COVID-19 into the scenarios for the exercising. We've also ramped up the suite of guidelines available within our system, including looking at matters of the supply chain and also on the area of shelter management. And this year, as a new feature, we've established an integrated regional logistics hub, and this is located in Barbados. And the intention here is to support our states in being able to efficiently distribute medical devices and supplies that are procured or donated for the region and which come into the region as a block. Of course, our preference is for direct delivery to the states, but we do have instances where some of the donations, for example, are coming to the region en masse, and we need to have a single location to receive those. So we've set that up in Barbados, and then we have worked out distribution channels to get them out to the states as well. Next slide. So what are some of the things that are working well so far on our side? I think the political posture of regional solidarity has been a very critical feature for our region. And under the umbrella of the Caribbean Community, CARICOM, the chair at the time of the onset of the COVID-19 within the region was the Honorable Prime Minister Mia Moore Motley of Barbados. And she provided, I think, sterling leadership. And the heads of government really rallied around the principles of regional solidarity. So a number of regional level protocols were articulated to treat with matters such as food security, procurement, logistics as well. We also think the governance arrangements and the inclusion of the health cell has been critical. That surveillance information, we get daily surveillance information, we look at the trends over time, and overall the CARICOM states have managed the COVID-19 pandemic quite well. The two countries which we are monitoring in terms of, I guess we can term it hotspots, are really Haiti and Suriname, where we do still have increases in the numbers of cases, although the rate of the increase is now slowing. But for the most part, in the other states, up to a couple of days ago, the curve was pretty much blunted because of the closure of borders and other transmission reduction measures. The coordination component, I think, has always also been very strong in terms of the institutions working together, particularly regional institutions and our national level institutions. There has been a very strong all-of-government approach, which has been adopted by all of our states. And of course, the guidelines, I think, have factored quite a bit in supporting our states, in guiding them on actions to be taken. Next slide. On the challenges side, and I suspect these are challenges that may be seen in some ways globally, but particularly within the small island context. First is this issue of the fiscal space for operational readiness. Significant resources were diverted within the CARICOM states from national level budgets to be able to address the preparatory actions for COVID-19. In fact, many of the states have set up specific facilities to be able to manage COVID patients because we had limited capacities for dealing with critical care patients. We had to purchase in a number of our countries ventilators and various other medical devices to really ramp up the national level capacity. And that was, the expenditure there was significant. So we do have limited resources now to look at other operational readiness issues. We are also anticipating that there will be some challenges in the area of surge support. And this is a critical feature of our regional response mechanism because we work on horizontal cooperation. We assist each other as sister states. And we are anticipating matters related to access to those human resources, some possible limitations with respect to that, the timeliness of being able to deploy, because our states, of course, have put in place measures which will govern the deployment of personnel, and these are varied measures as well. And this, we anticipate, will cause some time delays in when the surge support can arrive. And also on the whole aspect of the requirements on the health protocol side at the national level, and I mentioned these are varied. So these are issues that we are managing on this side. We also have a varied risk perception of the population, and I suspect this is the case globally, certainly from what I'm seeing on the news reports, etc. And even though we have had excellent adherence to the protocols, etc., we do realize that there is a diversity in that perception of the risk posed by COVID-19 across the population, and this is something I think all as states we have to manage. In addition, and the final point on the challenges is really with respect to looking at how we efficiently execute some of the normal emergency functions within our systems, and shelters were mentioned by all of the previous presenters, and it is a major consideration here in the Caribbean as well, with the limitations which are governing from the perspective of the health protocols and the physical distancing requirements. Countries have had to look at identification of additional spaces for shelters, and similarly to one of the previous presenters, we have also looked at repurposing existing buildings. So in countries where traditionally schools, for example, have not been used as shelter, they have been incorporated into the shelter mix for 2020. Also matters of evacuation. We're looking at revising the standard operating procedures. Some countries have already done it, and I was listening very keenly to the experiences of the other regions, because what you have indicated to us is what we anticipated may potentially happen. And we're also looking specifically at that search and rescue function as well, and how do we do it safely in a way that does no harm either to the persons delivering the function or to the beneficiaries. Next slide. So advice to other states, as I said, we haven't had the impact as yet, but some things we are seeing. One is that we have to be mindful of our multi-hazard environments. Even though we're discussing cyclones today in the Caribbean, we are prone to a multiplicity of hazards. And right now we're under a drought. We have COVID-19 ongoing, and we know that some of the antecedent conditions related to drought can have ripple implications for the level of impact of extreme rainfall events and produce significant landslides, for example. So this is something we want to reiterate, really to underscore the message of resilience, because for us this is key. We are promoting a message also of self-sufficiency at the level of our states and a greater emphasis on national level preparedness, given potential delays in the regional system being able to reach you in the usual timely manner. Flexibility and adaptability, I think, is going to be key, because many of our states are now at the juncture of the discussion of reopening the borders, and we have had good success by having very closed borders thus far and being able to control the epidemic. But when we reopen, in fact, we're already seeing it in some of our states, there is going to be that scenario of reimportation of the disease, and we have to manage that and adjust systems to suit. I also want to stress the point on vulnerable groups, gender and psychosocial considerations. And on the vulnerable group side, because we have had such a drastic change in the Caribbean in terms of the impacts to livelihoods, we do have more persons now who fall into the category of the vulnerable groups or the marginal groups, and this is something we are managing from our side. And finally, just to send that message that we view COVID-19 really as an opportunity also for change, and we are encouraging our states to use the opportunity to really reset the bar in terms of where we want to go in resilience and operational readiness. Thank you very much.
Thank you very much, Liz, and congratulations to you and Sedima for obviously a tremendous amount of work to prepare for the current hurricane season. And I have to say, you have conveyed a sense of absolute confidence, and I know it's going to be a tough road, but it's really amazing to see how the resilient spirit that I'm sure you and your team are taking to this very, very difficult challenge. So thanks very much for being here. I know you have to go. You have a hard stop at 9 o'clock. So thank you so much for joining us. I think we will continue on with a discussion. I know we were going to try to close at 9, but the information that our speakers have conveyed is extremely rich. So we will extend for anyone who is able to stay on for a discussion. The mechanism for raising questions or asking questions to the speakers, or just to open this up to a discussion, is this slido.com application, which you can see the details here on the screen and download to your phone and send us some questions. David is going to be telling us what kinds of questions we're seeing. So we'll give people a few minutes to post questions. There we go. Okay, Kamal, first one seems to be coming towards you. That's a great question about the capacity of emergency shelters and how do you prioritize which communities are given those spaces? I would say, how do you prioritize communities and people? How do you make those decisions when you're reaching full levels?
So I think the simple answer is that the emergency shelters themselves are managed, are community managed. The emergency shelters themselves are multi-purpose cyclone shelters. So it's the communities that decide. So each community, like without COVID-19, each community has a a multipurpose cyclone shelter that they manage themselves. So we don't decide who goes there. It's already pre-decided. Now, because those shelters now cannot be used to full capacities, with communities, with discussing with in India it's called Gram Panchayat, we have done pre-identification of other facilities where they can be divided up so that they are not all in the same place. Mm-hmm. So there is no prioritization really required. It's just that how you have to augment that capacity, and in addition to that, help the community think this through and reorganize themselves so that there is no mixing of different cohorts. Elderly people are given special attention, even more attention than you would give them in a cyclone in normal times. Thank you.
Great, thank you. I know Liz has probably had to drop off, but the question on the importance of self-sufficiency in responding to risks, I think that Esleen, you also talked about that in the context of Vanuatu, of feeling that confidence that these were things that the Vanuatu people can and will be prepared to take forward. Would you be able to talk a little bit more about that self-sufficiency, that aspect of solidarity? If Esleen is still with us.
Can you hear me?
Yes. Okay, now we can. Thank you.
Okay. Yes, I think people should accept that, like for Vanuatu, for example, we tend to preach like we preach out that natural disaster is everybody's business. So we don't rely on anybody, but we ensure that we own the operations. We are part of it, so we don't necessarily rely on other people to do things for us. With the structures that are in place, we also train the local communities in that mindset as well. So whenever there is a disaster, everybody takes the responsibility to react to it.
Okay, thank you, Esleen. That's great, and I think that's a trend as we watch all of the news and the developments around the response to the COVID crisis, is the trend of pushing in a positive way decisions and autonomy and authority down to local levels. These become issues that really need to be very much owned, driven, and decided by local authorities and communities who take the responsibility into their own hands. And then, as you say, once that happens, you can have a situation of solidarity and bringing everyone together to respond to what's an incredibly serious set of circumstances. I want to maybe ask Professor Nomura, can you respond to this question on actionable recommendations for improving emergency preparedness and response capacity? You gave us a lot of concrete things that Japan is doing. Did you need to change the underlying policy framework for that, or what can you tell perhaps other countries that may not right now have a policy framework for that about what's necessary to support those actions from a policy perspective?
Thank you for your question. In Japan, basically, we applied past rule and law, but for this time, we changed so many rule and law. But basically, we apply the current regulations. but in the government discussed, and so some law is developed and changed.
That's quite interesting. I think one of the things we saw early on in the process here was that the underlying legal and regulatory frameworks for action in many countries were disaster risk management laws and policy frameworks, particularly the declaration of emergency sort of statutes and metrics and rules. And so as we see here, this is certainly an area where the disaster risk management tools and approaches, as someone said at the beginning, I think it was Kamal, the tools and approaches, the things we've been working on in disaster risk management space for many, many years are now being utilized and adapted to the current context. So I think that adaptation is a really important aspect of also what we're seeing from these country experiences. So the natural disaster, we see a cyclone coming, it hits, we have an impact and we have response. That's the typical way that we have been managing those disasters. But now at the same time, we have a dynamic situation where the impacts of COVID are fluctuating, are going up and down. I was particularly struck by Vanuatu's the explanation that you gave, Esleen, about how the state of emergency was lifted for about 3 days and then put back on. So that adaptation of the policy guidelines, the legal frameworks is something that I know almost every country and every community is struggling with. I really like this next question that's popping up about consideration of engagement and partnership with private sector counterparts. I think, Esleen, you mentioned this one. If you wanted to answer that, or Kamal.
So, Julie, that's a very, very, very important question, and it has become very clear that we can't handle the current situation without the active engagement of the private sector. Basically, I would say there are three areas where we need to build partnership with the private sector. The first is with regards to generating resources, generating equipment, generating the wherewithal for the management of the current pandemic itself. For many things, a whole new industry has to be set up. Just to give you an example, around March, around the third, fourth week of March, we used to produce personal protective equipment in hundreds, and now we are producing 500,000 every day. And that can't happen. The government can't do this. You have to, from standard setting to manufacturing new fibers to actually doing it, it really requires private sector's entrepreneurship. That's one. The second thing is that the impact of the pandemic itself is huge, and economic recovery cannot happen unless the private sector exercises some imagination. So what is that? How are we going to do that? So that is the second area. And the third is that by all accounts, it appears that the pandemic is going to be with us for another 12 months or even 18 months, in some form or the other. At least the risk will continue to be there. So how the industrial outfits, how the manufacturing units, how will they integrate COVID-19 principles? How would the cafeteria in a factory work? So I think we really need to make a very close partnership in also, the much abused term, introducing the new normal in the operations of the private sector. If we did these three things, it would be a very meaningful engagement with the private sector in handling these multiple crises.
Great, thank you, Kamal. I wanted to throw in another question. I don't see it coming up here, but it has been on the minds of as we were planning this, and perhaps while we still have the speakers here with us. What can you tell us about the interactions with health agencies and actors? Was that something that happened immediately and quite easy? Were those relationships already in place? it's certainly something that has been happening as we mainstream disaster risk management into many sectors. We have, there's been lots of examples of countries that have already started to do that, but this really accelerates that collaboration. Any of the speakers want to address that? Professor Numada, I don't want to put you on the spot, but I would be quite curious about Japan's experience on that one.
Okay, thank you. So in Japan, so we have some workshop with medical staff, medical people, and disaster management professionals. So when we discuss with medical people, they want to collaborate with disaster management people. But before COVID-19, disaster management people and medical people is separately work. But they wanted to talk, to collaborate each other. So then this is a very good chance to collaborate. Then now our DMTC training center provides training program with disaster management people and medical people. Then they study each other. Then now we made around 300 process only for the shelter management with collaborate knowledge from medical people and disaster management people. Then now we share the SOP, new SOP.
Yeah.
This is one case. Thank you.
And see if you wanted to address anything on the Disaster Risk Management Act, and also my question about how you're collaborating with the health sector agencies. What's working well, or what are the challenges in that phase?
Who's the question to?
Yes, go ahead. I think Esleen may still have connective problems. So, Kamal, do you want to address that one also? Kamal, on the health sector collaboration. Kamal? Okay, looks like we might have lost the rest of our speakers. Let me give Esleen. Esleen, are you still with us? There, I think you are.
Yes, I'm
Okay,
still
thank
here.
you.
Collaboration with the health sectors.
Yes.
In Vanuatu, at the beginning of the COVID-19, every operation was with the health ministry. Until we know that when there was a declaration about it as a pandemic, then it comes to the National Disaster Management Office. So how we work with them, we have a national advisory team, health advisory team, that gives advice to the National Disaster Management Office that is coordinating all the operation for response to COVID-19. All the protocols that are designed by the National Disaster Management Office and instructed by the Disaster Management Office, the protocols are designed from the advice from the health advisory team. So there is a very good working relationship between the Ministry of Health and the Disaster Management Office. So we identify them as the Ministry of Health is always the advisory team for the operation of the Disaster Management Office in COVID-19 issue. So we differentiate that one. So we respect the boundaries. We respect the boundaries that the health ministry, we cannot do any operation, we cannot instruct any protocols we cannot come up with any protocol without any confirmation or any advice from the health ministry. We really depend on each other to be able to come up with some advices, protocols to our local communities, but also to the national government on the way we manage the COVID-19 issue in Vanuatu.
Great, thank you very much. And just a quick follow-up on that, Esleen, but the DRM Act continues to be the main framework, legal framework for declaring an emergency. Is that correct?
Yes.
Okay.
So we can declare the state of emergency under the DRM Act, but we can also declare the state of emergency under the Constitution of Vanuatu. But the declaration of the state of emergency under the Constitution restrict a lot of rights of the people to move around, and so there is a lot of restriction from the state of emergency and the Constitution. So we prefer to declare, to continue the declaration from the DRM Act so that we can have specific instructions, and we are a little bit flexible in terms of the movement of people. Otherwise, as we have the advice from the state law that if we restrict, we under the DRM Act, we have no right to go against the right of the people to move around. That's the difference. But otherwise, all the state of emergency in times of disasters are declared under the DRM Act.
Sure. Okay, great. Looks like we have time for maybe one more question. So this is on the shelters. It's a question that's gotten a few likes here. With more shelters in COVID keeping social distance, how do governments manage information on those shelters? And I think including sort of this issue of the fact that you have to use facilities that were not originally designed as shelters in order to accommodate the social distancing. I know, Kamal, that you were addressing this in your remarks. Would you like to start off with an answer on that?
Yeah, I think I will repeat what I said earlier. We have to, so one of the things that we've learned in the National Cyclone Risk Mitigation Program is that the government can help build the infrastructure, but if in normal times, but if the management of that shelter infrastructure is with the government, it is a recipe for failure. It has to be managed by the communities, and when it is managed by the communities, they have the most intimate knowledge of local level risks. So that's one. The second thing is that the additional facilities that you identify in that area, there is some technical assistance given by the local government, state government, mapping schools and colleges onto a risk map. Risk map is something we did prior to the COVID-19. So that is coming in handy now. And then that information, when you make it available to the communities, they decide which ones will be taken up as shelters, augmented capacity in terms of shelters, and how they will manage this. If we begin to, dictate how that will happen from here, it is impossible. Number of people we evacuated in Odisha alone was 1.1 million. If we decided, who will go where, and you take a top-down approach, it is a short recipe for failure. So it really is bottom-up. The details of how that works, it is really communities who have to decide this. I don't know if that answers the question.
That's very, very profound. I think you're absolutely right, and that's a really important thing to note and as one of the key learnings right now. Maybe last question here. So Professor Numada, also on the issue of the private sector, I think this is a quite interesting question around the involvement and role of convenience stores. Can you provide any insight to that question?
Okay. So in Japan, not do you know convenience store?
Yes,
Like,
I do.
okay, 24-hour store. You can buy every day, every time. So this is very convenient. So in Japan, there are so many this convenience store. So then convenience store can support shelters. Then normally, if we visit shelter, maybe you can find convenience store near from this shelter. Then convenience store can provide materials for the people in shelters. So then before disaster, local government make a MOU with convenience store or other private stores. Based on this MOU, if disaster occurs, a convenience store or other private sector provide materials. So this MOU is very important because if convenience store or other private sector provide material, after that, government pay the money for the private sector. That's why private sector supports or help government. If no money, no MOU, even for private sector, they don't support. Because even for private sector, most important thing is to secure their own business. After that, they can support for the public service. So then Japanese system is very good, but everybody can work under the money or budget. That is actual situation. So then previous question related to the previous question, how we collaborate with private sector information of shelters. Normally, public health nurse visit shelter one by one. Then they get environment, how many people, who is here. Then they check every day all shelters. This is also important. If you buy some materials in your shelter, after that you can ask the money for government. That's why information is very important. That's why if you didn't record what you buy, what you bought, no data, it's very difficult to pay the money after that. That's why information is very important in the point of the budget or money. But Japanese Act make a rule. If you buy something, government can support. This is rule. This is a law. That's why everybody can buy necessary materials for the people in the shelter.
Oh, thank you for sharing that, and thank you for Shingo for raising that question. Otherwise, we might have missed that extremely interesting part of Japan's solution. So, I think it is time to wrap this up. I want to thank everybody for staying on the line, and a really, really big thanks to our panelists, Dr. Numata from Japan, Kamal Kishore from India, Esling Garabianti from Vanuatu, and Elizabeth Riley from Sedima. There's so much information in here. I don't think I'm up to the challenge of summarizing it all as profoundly powerful as in ways that our experts did, but maybe just a very quick summary from my side. So we're hearing a few really important themes: the importance of legal frameworks and governance, and the fact that in this situation, it's not just about a static reaction to one particular event, but we also have that plus a very dynamic situation where conditions are changing, where restrictions are eased and then perhaps put back on. States of emergencies are lifted and then perhaps put back on. So very dynamic process to the legal frameworks and governance. protecting first responders and managing the human resource aspects of staffing shelters and response. Again, not just surge planning for one particular event, a cyclone or a hurricane, but surge planning for that event, plus, again, volatility in the impacts of the virus, which we know will play out and change over time. And so you again have now an adaptive surge capacity requirement. Varied risk, the fact that, although we have in the typical tropical cyclone hurricane situation, we have most of the people in that community are at risk, vulnerable populations as well, and now a whole other layer of varied types of risks based on the populations that are more susceptible to the crisis on top of that. The role of capturing information and adapting existing disaster risk management tools and approaches. I like the way Kamal said lots of things are coming in handy now. So things that have already been developed, risk assessment tools, standard operating procedures, accelerating virtual assessments, accelerating the use of drones and technology. All of those things that we do every day in disaster risk management are coming in handy now in the issue of the compound risk environment that we're in. Collaboration with health agencies, obviously, certainly there's a really clear complementarity between what disaster risk management agencies are bringing with the tools and solutions for responding to natural disasters, and then the health and medical knowledge and expertise. And it's good to see those are coming together, and in all of the cases here, we saw quite a lot of collaboration between those two components. And then I think the two really big ones for me, reaffirming both the role and the importance of decentralizing decisions, authority, autonomy, and response actions to communities, to the local level. And then when that happens, also there's in the cases we saw here, quite a lot of solidarity and even a bright spot of hope for self-sufficiency when communities come together to respond to the unprecedented nature of the challenges we're facing. So thank you so much. This is the beginning of a conversation. GFDRR is planning, at the suggestion of Kamal, who's our co-chair, to do a longer paper and assessment on some of these lessons. We're still waiting for some of the lessons to materialize. I think even the next 3 months we've learned so much in the past 3 months that the next 3 months will be incredibly rich as well. So please stay in touch, keep following us, send us any more questions if you have them. And as I said, the session has been recorded and will be available on our website, gfdrr.org. Thank you so much, everyone. Please have a wonderful day, evening, and take good care. Stay safe. Thank you.
Okay, thank you very much. Bye.
Thank you very much, everyone.
Thank you very much, everyone.